Do you see yourself every day in the bathroom's mirror? Do you see a thinning process on your head? Or does it get worse by the days and weeks? And you are afraid of getting bald? Well, you're not alone. Growing number, especially men, getting bald every year. So to get your answer, you may check out this video, because as a medical professional I will discuss the treatment of baldness, both with conventional and alternative medicine. Bear with me until the end of this video, I promise. If you follow the right path you can get back most of your hair. Welcome to our channel, Doctor on Tube. We are a group of dedicated medical professionals and herbal researchers. This is an up-to-date treatments for the most known cause of baldness, and that is androgenic baldness. Hair grows in a cycle of 4 phases. The anagen phase is an active growing phase that lasts around 4 to 6 years, and after this phase hair follicle regresses because the hair follicle detaches from the papilla at the root. It means it detaches from the blood supply, so hairs get weaker at the roots and migrate upward. This phase is called catagen, which lasts about 2 weeks, and subsequent 3-month-long resting phase of growth called telogen phase. And at last, falling of hair called exogen phase. It happens because of the new hair pushes out the old one.
You normally lose between 50 to 100 scalp hairs each day because 85% of your hair is in active growing period, but only 15% are in the resting phase. Many baldness-like androgenic type occurs when the balance between growing hair and resting hair cycle is lost. It means shorter growing cycles. It results in smaller and shorter hair because the follicles don't get the needed time to grow, so hair gets smaller and thinner. This is called miniaturization. Either lack of growth hormones or dihydrotestosterone plays a major role in this process.
The most common cause of hair loss, which you almost encounter every day, is the hereditary alopecia, also called androgenetic alopecia. The hormone dihydrotestosterone, or DHT, plays a major role. The enzyme 5-alpha reductase converts testosterone to DHT. It shrinks hair follicles by shortening of growth cycle and causes miniaturization. It also makes it take longer for your follicles to grow new hairs once old hairs fall out. So, it means most of treatments this type of hair loss must involve either inhibiting 5-alpha reductase enzyme or blocking DHT. Androgenic hair loss usually has no symptoms other than shedding. It increases with age, and it affects over 70% of men and 50% of all women over the age of 80. It is less likely in Chinese, Asian, and blacks. In men, thinning begins at the temples or crown and can spread to nearly complete baldness. Hair thinning in the frontal, parietal, and crown regions is typical of female pattern type. An interesting study has shown men with entirely bald heads were perceived to be more masculine, taller, dominant, and about 13% stronger than those with full heads of hair, according to this United States study conducted in 2012. There are several therapies available for the treatment of androgenic alopecia, with 5-alpha reductase inhibitors and minoxidil most commonly used. We will discuss all the known conventional treatment for this condition one by one. Remember, the alternative therapies is coming up after conventional treatments. Minoxidil, 2% for women, 5% for men, works by mechanisms that are not completely understood. Only 30 to 40% of patients experience significant difference, but minoxidil is generally used for alopecia areata. Regrowth can take 8 to 12 months. Finasteride inhibits the 5-alpha reductase enzyme, blocking conversion of testosterone to dihydrotestosterone, and is useful for male pattern hair loss. Finasteride 1 mg orally once a day. If it has effect, it will show before 6 to 8 months if one can tolerate side effects such decreased libido, gynecomastia, erectile and ejaculatory dysfunction, which may persist even after stopping of treatment. Dutasteride is a stronger inhibitor of 5-alpha reductase than finasteride and is sometimes used to treat androgenetic alopecia. Some hormonal modulators such as oral contraceptives or spironolactone may also be useful for female pattern hair loss. Low-level laser light therapy is an additional treatment for androgenetic alopecia, but its effect is still an active area of research. A 2019 study published in Lasers in Medical Science found that the laser therapy increased hair thickness and covered bald patches in both genders. Platelet-rich plasma is plasma from patients' own blood that has been separated from the other blood's components. It's stimulating hair growth because it contains growth factors. Treatment is done by direct injection into the scalp. Now, this section isn't just for androgenic type baldness, but almost any permanent hair loss can be treated surgically. Surgery is a fast solution for baldness, which almost no other treatment can match up to. This includes follicle transplant. It is a surgical technique that removes hair follicles from one part of the body, called the donor site, to a balding part of the scalp, known as the recipient site. The technique is primarily used to treat male pattern baldness. Hair follicles are taken mostly from places that are more resistant to hair loss, like the back of the head. Donor hair can be harvested in 2 different ways. In FUT, a strip of skin is taken out, 1 cm wide and 15 to 25 cm long with linear suturing, and it heals with a linear scar. FUT is cheaper with a shorter operating time, but stitches are required with possible scarring. FUE is short for follicular unit extraction, also known as follicular transfer. It's transfer of groups of 1 to 4 follicular units by a small millimeter-sized needle for extracting follicular units from the donor site. In this method, no scarring is seen because it requires no stitching. It has a shorter recovery time of just 1 day with a shorter healing time, but it is more expensive with a long operating time and with multiple sessions required. Scalp flap surgery moves hair-bearing scalp to the bald area, providing instantaneous hair coverage. This transfer from one site to another is usually done in a series of procedures. Depending on which areas are needed, different techniques are used. The most known is rotation flaps, where one's the bald part surgically taken out and part with good hair coverage neighbor to that are cut and rotated in a procedure to fill the gap. It gives instantaneous coverage but with stitches and scarring. Scalp reduction or alopecia reduction is an excision of an area of alopecia. This technique are used for male pattern hair loss and also for cicatricial alopecia. It works best when used in combination with hair transplantation. Ideal candidates are males with Norwood grade 4, 5, and 6 who are above the age of 40 with stable hair loss. These patients should have little or no hair in the scalp but have dense hair on the sides and back of the head. Complication of this procedure is distortion of bald area, slot deformity, which is meeting of both the sutured edges in the midline with hair growing in opposite directions. It has been seen that alopecia reduction can accelerate baldness because of the fact that area of future baldness is stretched over a wider area in a younger patient. It can give both anagen and also telogen hair loss too, especially near the suture lines. The treatment of alopecia has a lack of sustained disease remission. Given the negative psychosocial impact of baldness, patients that don't see significant hair restoration with conventional therapies often turn to complementary and alternative medicine, also known as CAM. There are a variety CAMs on the market for alopecia, however, only a few are backed by strong scientific and clinical evidence. Natural products do not require FDA approval. The 2012 National Health Interview Survey reports natural products to be the most popular CAM approach for dermatologic conditions, used by 18% of Americans. In the next few minutes we will discuss alternative remedies for different types of alopecia. Precyanidins are a class of flavonoids found mainly in plants, including apples, barley, cocoa, cinnamon, grapes, and green tea, described to have antioxidant, anti-inflammatory and antifungal capabilities. It is demonstrated to be one of the most effective and safest natural compounds in promoting hair growth both in vitro and in humans by topical applications. Topical 1% prostaglandin B2 and 400 milligrams of its oral compound was investigated separately in a double-blinded, randomized clinical trial in patients with androgenic alopecia. It demonstrated increased hair density by 110 to 125%. Components from sharks and mollusks have been produced for many years as an enhancer of hair growth. A Scandinavian research in Inuit peoples shown healthy skin and hair to be a result of their fish and protein-rich diet. Originally marketed as hair gain and later Viviscal, thought to increase hair shaft diameter and decrease hair loss. One study has shown taking orally marine protein supplement or MPS 3 times daily in 100 females for 6 months demonstrated a significant increase in the mean hair diameter as well as a reduction in shedding. Transforming growth factor or TGF-beta1 inhibits hair growth. Unfortunately, testosterone increases expression of this factor, but caffeine can downregulate this expression. Besides, it also increases the expression of a very known hair growth promoter called IGF-1, short for insulin-like growth factor 1. 6 months of daily caffeine shampoo use resulted in a reduced speed of hair loss progression. Caffeine lotion has also been tested with similar results. However, studies are limited by a lack of standardized scientific evaluation.
Capsaicin is an active component of chili peppers. It is a chemical irritant and produces a sensation of burning in any tissue with which it comes into contact. Pure capsaicin is a hydrophobic, colorless, highly pungent, crystalline to waxy solid compound. Oral capsaicin 6 mg plus isoflavin 75 mg daily for 5 months increased mentioned hair growth promoter factor IGF-1, so it can be used to treat patients with androgenic hair loss and alopecia areata. In androgenic hair loss specifically, 88% observed hair growth following treatment. You can also apply capsaicin cream daily to affected scalp. It has been seen good effect in patients with alopecia areata after 3 weeks.
Substance called ginsenoside in red Korean ginseng is said to stimulate hair growth. Its effect is done by preventing cell death of hair follicle cells and inhibiting 5-alpha reductase effects on follicles. Empty 2 capsules of red Korean ginseng into a bowl. Add 1 tablespoon carrier oil and mix it thoroughly. Apply it on the areas of thinning hair by gently massaging the mixture into your scalp for 5 minutes and let it rest for at least 35.
Rosemary oil appeared to be a safe non-prescription alternative for androgenic baldness. It is an aromatic evergreen herb with antioxidant, antibacterial, antifungal, and anti-inflammatory properties. It also enhances microcapillary perfusion and stimulates new hair growth. Mix a few drops of rosemary oil into a carrier oil like jojoba and massage it into your scalp before washing. Do this a few times per week. You can also add a few drops of rosemary oil into your shampoo on a daily basis. Geranium is a genus of 422 species of annual, biennial, and perennial plants that are commonly known as geraniums or cranesbills. They are found throughout the temperate regions of the world and the mountains of the tropics, but mostly in the eastern part of the Mediterranean region. There is scientific data indicating that geranium oil may be beneficial for a number of conditions, such as anxiety, depression, infection, and pain management. It's thought to have antibacterial, antioxidant, and anti-inflammatory properties. You can use geranium oil to promote hair growth by mixing a few drops into a carrier oil and use it to make a hair mask, or add it to your daily shampoo and conditioner. Since geranium balances secretions around the hair follicles, it's an effective agent for hair growth. While there isn't much research on geranium's effects on hair, a 2017 study published in BMC Complementary and Alternative Medicine found it did promote hair growth. Lemons contain lots of vitamin C, which boosts collagen production. Besides that, it contains many other nutrients such as antioxidants which strengthen the hair follicles, therefore it encourages even dormant hair to grow. You can use fresh lemon juice or its oil. Apply fresh lemon juice to your scalp and hair 15 minutes before you shampoo. It's shown lemon essential oil diluted in a carrier oil works faster. Melatonin is a neurohormone secreted by the pineal gland that regulates mammalian circadian rhythm. Usually individuals who take melatonin do so to treat sleep issues and take supplements in the form of pills. But recently, scientists have started using melatonin topically to research the effect it may have on hair health. 5 clinical studies showed positive effects of a topical melatonin solution in the treatment of androgenic alopecia in men and women while showing good tolerability. Other studies has shown significant reduction in baldness was observed in women while in men remained constant. Overall, after treatment with melatonin, patients with diffuse alopecia had a significant increase in active growing hair at the occipital versus the frontal hairline.
Pumpkin is a member of the squash family native to North America. Pumpkin seed oil contains phytosterols known to inhibit 5-alpha reductase, preventing testosterone to active dihydrotestosterone. In addition, this study showed that this seeds is a promising treatment for androgenic involving the vertex but failed to address the supplement's effect on frontal variants. If you are not interested in using finasteride, you can use saw palmetto. It is an extract from the berries of the saw palmetto palm tree. American dwarf tree is a competitive inhibitor of both forms of 5-alpha reductase and 3-alpha hydroxysteroid dehydrogenase activity, increasing the conversion of dihydrotestosterone to its weaker metabolite, androstenediol. As a result, the pharmacodynamic profile of saw palmetto differs from finasteride due to multiple sites of action. It's recommended to use it topically than orally for treatment of androgenic hair loss. If you Google it, you will find out that there are different recommendations for using eggs for your hair loss. Some say you should just use egg yolk and others mean egg white has promises. But it should be noted that egg yolks contain vitamins A, D, E, and K, along with omega-3 fats, compared to the whites, which are rich in protein, sulfur, phosphorus, selenium, iodine, and zinc, all of which are important for preventing hair loss. So to endorse just egg yolk or egg white has no scientific or logical reasoning to it. Instead, we suggest a mask of 1 whole egg, mix with a teaspoon of olive oil and honey for applying to your scalp and hair. Rinse after 20 minutes with a mild shampoo.
Licorice root considered one of the world's oldest herbal remedies. It is also one of the highly recommended treatments for hair loss. It is believed that pores of the scalp open up due to its mollifying properties and reduce irritation and redness, resulting in hair growth. Although scientific research about its potency to help grow dormant hair are limited. Make a paste by adding a tablespoon of ground licorice root and a 1/4 teaspoon saffron to 1 cup of milk. Apply this to your scalp and leave it on overnight. Wash it next morning. Do this twice weekly.
Although there has been a lot of research around green tea and the possible health effects of drinking the tea regularly, there is little evidence that drinking it has any effects on your hair. There is discussion around how it can actually stop hair loss. It is believed that the catechins found in the tea had 5-alpha reductase inhibiting properties. But always question asked, does the tea repress dihydrotestosterone and stop shedding? Or does it simply aid hair growth? Now, recent studies have suggested green tea's anti-inflammatory properties are linked to hair growth. Study with mice showed hair loss slowed down in all mice who received the tea in their drinking water. It was found that the green tea even triggered new hair growth. Soak 2-3 or more tea bags depending of your hair length in 1-2 cups of hot water. When it cools, pour this over your scalp and hair while gently massaging your head, and rinse with cool water after an hour. There are a great number of people who recommend beetroot juice for stopping shedding hair, but more research is necessary for a comprehensive and reliable assessment of the positive effects of beetroot juice. Beetroot is rich in carotenoids, vitamins C, phosphorus, calcium, vitamin B, folate, manganese, betaine, and potassium. It's also rich in lycopene, make it an extremely effective dehydrotestosterone-blocking food. Make a paste by mixing 7 to 8 boiled beetroot leaves with an entire beetroot, 2 teaspoons of henna powder and a teaspoon of coconut oil. Apply this paste on your scalp and leave for 15 to 20 minutes before rinsing with warm water. Greek yogurt are rich with riboflavin, niacin, calcium, choline, iodine, and lots of protein, vitamins B12, B7, and B5, ingredients that helps with blood flow to your scalp and hair growth. The lactic acid in yogurt helps to hydrate the hair and helps to clear away dead skin cells. It's recommended to use it as a mask, especially when it's used with 1 or 2 tablespoons honey and lemon once or twice a week. Fenugreek is an herb native to southern Europe, the Mediterranean, and Western Asia. It looks similar to clover and has seeds that taste and smell like maple syrup. In Ayurvedic and Chinese medicine, fenugreek has been used to boost digestion, induce labor, for easing menstrual cramps, diabetes, promoting milk production for breastfeeding, and to promote hair growth. Some early research has shown that fenugreek seeds can treat low to moderate hair loss in men and women. It may stimulate blood circulation or may interact with dehydrotestosterone, although more studies, especially human studies, are needed to determine if and how fenugreek can help grow hair. Indian gooseberry or amla, beside being rich in vitamin C, iron and calcium, antioxidants, it has anti-inflammatory and exfoliating properties. Amla helps promote faster growth of hair, prevents premature graying, but most of the reported health benefits of amla oil have not been scientifically proven. A 2012 study found that amla oil was a powerful inhibitor of 5-alpha reductase. Massage to your scalp and hair a paste of amla powder and lime juice, and keep it moist for an hour before rinsing with normal water. Stress can disrupt the process of hair growth and lead to premature graying. Try to avoid stress. Also, hot showers dehydrate hair and strips the scalp of its natural oils, leading to dry, brittle hair that's more prone to breakage. At last, avoid combing your wet hair because they are never more fragile and prone to breakage when wet. We hope you got what you came for. Our goal is to educate everyday people to a degree that they can choose a treatment for themselves and help others in need. So until the next video.
Year-old male back